This mistake is canceling out the effect of your diabetes medication. In this video, I'm going to tell you about the morning mistake that many people make, and it can compromise your diabetes treatment, preventing your medication from working. Look, this is really important. You take the medication to lower your blood sugar levels to keep things under control, but because you're making this mistake, you don't get the desired effect from the medication. Let's talk about this. And why am I going to focus on the morning period? Because this morning period, right after you wake up, is a very delicate time. Why is that? During sleep, when you're sleeping, your liver can produce sugar. So that's why you might go to bed with normal blood sugar levels. They're good. You have a good blood glucose level, but when you wake up, that level is higher. Have you ever wondered why this happens if you haven't eaten anything? So it's because the liver produces sugar. The second reason is that in the morning, right after you wake up, when you get up, naturally, this happens to everyone, it's normal, the body produces more hormones like cortisol, glucagon, growth hormone, and even adrenaline. So it's a period when you're more susceptible to having blood sugar spikes. And these mistakes, here are things you should avoid to have good control and for the medication to work. There's no point in just taking more and more medicine if you don't do the basics that really will improve your glycemic control, your diabetes management. I've listed here 4 of the main mistakes that can cancel out the effect of the medication. What's the first mistake when it comes to liquids? Did you know there are liquids that can cancel out the effect of diabetes medication? I'll explain it to you. If you're taking any medication like metformin itself, or medications that eliminate sugar through urine, or even diabetes pens, there are several diabetes medications. If early in the morning, when those 2 things I mentioned are already happening in your body, you drink a beverage with a high concentration of carbohydrates, if you're already diabetic, what can happen? Your blood sugar levels will go up, right? And which drinks do you need to watch out for, especially in the morning? I'm going to highlight fruit juices here. A lot of people drink juice in the morning. Oh, I'll have some orange juice, I'll have some grape juice, some mango juice, some apple juice. Just so you have an idea, a juice, for example, with orange juice, a medium-sized glass usually contains about 5 or 6 oranges. That can give you more than 20 grams of carbohydrates, and that's first thing in the morning while you're still fasting. You're breaking your fast with exactly what you shouldn't. Drinks that are high in carbohydrates with a high glycemic index and a very high concentration of carbs. That's what glycemic load is. It's how much carbohydrate is in there, how much sugar is in there, okay? So avoid drinks with a high glycemic index and also with a high concentration of carbohydrates with a high glycemic load. Those fruit juices and soda, well, don't even get me started on that, right? I believe you're not drinking it first thing in the morning, because if you are, you really need to rethink a lot of things. You already know that's a no-go. But juice is a big trap, isn't it? Especially for diabetics. Now, for those who aren't diabetic, that's what happens. You drink a glass of juice and it can end up making you diabetic. We've already talked about this. But diabetics need to have special control. And the same goes for coffee with sugar. A lot of people like to drink coffee and add a lot of sugar. If you're adding more sugar, you might be canceling out the effect of your medication. Wait, what do you mean canceling it out? Explain that to me a little better. Well, you're taking medicine to control it. If you're overloading with sugar, the medicine might not have the expected effect. You get it? So you have to be careful. That's why a lot of patients think, and I've heard this many times, that diabetes medication makes your body build up a tolerance. You end up needing more and more medication. That's not true when it comes to diabetes medications. But why isn't that true? Because these medications have already been studied and they don't cause that. What actually causes this tolerance effect where you need more and more medication are exactly the mistakes I mentioned here. If you wake up and go straight for a juice and make other mistakes too, there won't be any medication that can help in time. There's no point in just taking more and more medicine if you're not fixing this. So be careful with added sugar and drinks with carbohydrates, because for diabetics, this can really raise your blood sugar levels a lot. It's also worth highlighting here, still on mistake number 1, not staying properly hydrated. So let me mention a drink here. So without sugar, water, for example, or even coffee, which can help diabetics, okay? As long as it's without sugar. Oh, but can it be without sweetener? Do I have to cut out sweeteners too? Because I saw a video from a doctor saying that sweeteners could raise blood sugar levels, could increase insulin just because of the sweet taste. Sweet, sugary. Is that true? That's a big lie, okay? It's nonsense that goes around on the internet. So you can use natural sweeteners without any worries. Stevia, for example, you can use it. Of course, you shouldn't pour a whole bottle of sweetener into each cup of coffee, right? Just a reasonable amount, like 5 or 6 drops, for example, won't harm you, won't cause any changes to your gut microbiota, which a lot of videos talk about too, okay? So yes, you can use it safely. The second mistake, and this one can also sabotage your diabetes treatment, is using anti-inflammatory medications without a doctor's prescription. And I'm going to highlight a specific class here, which these are the steroidal anti-inflammatories. Which medications are these that can raise your blood sugar levels? Mainly here, we're talking about glucocorticoids like prednisone, prednisolone, dexamethasone, hydrocortisone, okay? These medications, after you've been using them for a while, especially without supervision, after 10 days, 14 days, look, that's just a few days, right? You probably thought that to have these effects of raising blood sugar levels, you'd need to use them for a longer time, didn't you? Did that surprise you or not? If it surprised you, go ahead and like this video, okay? But let's talk more about these medications. They can raise your blood sugar levels. If you're using them without medical supervision, there are some specific diseases, rheumatologic diseases, for example, where the doctor might turn to and prescribe corticosteroids. But with proper supervision, the doctor can minimize these side effects. Now, a lot of people are like, oh, my joints hurt, I'm feeling a bit swollen, I'm feeling this or that, so I'm going to take an anti-inflammatory. But actually, in the medium and long term, that can really harm you. I see this a lot in my practice, that people use these medications on their own, and they end up experiencing a lot of side effects. In fact, those steroidal anti-inflammatories I mentioned can actually cause swelling after a certain period of time. You're taking medicine to fight inflammation, which is from the anti-inflammatory class, but without proper control, it can actually cause inflammation. Look, isn't that interesting? And now you might be thinking about another class, also anti-inflammatories, but the non-steroidal anti-inflammatory drugs. Which medications are those? Nimesulide, diclofenac, ibuprofen, naproxen. These medications don't have a strong interaction with blood sugar levels. However, they can raise blood pressure. So if you have high blood pressure, you need to be careful with these medications too. You see how all medications have some unwanted side effects? That's why it's so important to have medical supervision. And now, the mistake. Number 3, which happens right in the morning. And this mistake here can really cancel out the effect of the anti-diabetic medication, which is eating foods with a high glycemic index right in the morning. For example, bread with jelly, bread with sweets. You're putting jelly on it, maybe strawberry jelly or maybe apple jelly, grape jelly. You're eating cake, not just made with flour, but also with added sugar. Or those little cookies, which often say on the label that they're whole grain cookies, but many of them have added sugar. Well, these foods that you take out of packages, so cakes, breads with sugar, those cereals with added sugar, cornflakes, don't even get me started. You need to be careful first thing in the morning. Why? If you're taking medicine to lower your blood sugar and eating a lot of sugar, it's not going to work. It doesn't make much sense, right? And the medicine also won't have the desired effect. And now you might be thinking, oh, I already know what's raising my blood sugar levels. I already know. It's the fruit. Fruits with carbohydrates, with sugars, right? The answer is no, okay? Fruits, even if you eat them first thing in the morning, if you eat fruits with fiber, like an apple, or if you're eating a peach, a strawberry, cherries, and even watermelon. Of course, if you control your portions, this won't increase or cancel out the effect of diabetes medication because fruits are healthy. They have fiber, vitamins, minerals, and they can help you, okay? If you think I'm going to badmouth fructose or fruit here, what really does harm, it's foods with fructose syrup, corn syrup, those foods with added sugar. Those, yes, you should avoid. If you're diabetic, then you need to be even more careful. And mistake number 4 can cancel out the effect of the medication. And this one, a lot of people neglect, which is not having a routine. And I'm talking about 2 routines here. The first routine is your sleep routine. So your body knows what time it needs to produce hormones. So you can regulate your circadian rhythm. So have a set time to go to bed and a set time to wake up. Does that mean you can never change those times? It doesn't mean you have to stick to a routine where on most days you go to bed and wake up at the same time. But if you have a party, a graduation, for example, a wedding, you're not going to skip it because of that. Once in a while, sure, you can be a little flexible with your schedule, but your body needs to understand. It needs to know what time of day it is. Well, you need to have a general idea of the time when your hormones are active. So you need to have the first routine I'm talking about here, which is your sleep routine. And also, the second routine is to take your medication at the prescribed time and always at the same time. Why? Because imagine that one time you take your medication at 6:30 in the morning, and another time you take it at 9:30, sometimes even 10, because you woke up later, because your routine changed. Look at that. If the medication's designed to work for 24 hours, there will be a period when you're left unprotected. So this can directly impact your treatment because if you don't have a routine for taking your medication, if you don't have a set time, you really need to have that. This will benefit you. It'll help your body handle the medication better, and it won't cut off the effect of the medicine. You'll be left unprotected. There, a period that can be very harmful if you're diabetic. Sometimes the doctor will look at your test results and it will change your treatment, when in reality, just making this small adjustment would already benefit you a lot. So let's review the mistakes I mentioned. Pay attention to the medications, those anti-inflammatories I mentioned. You need to remember those names. All right. Second, you need to be careful with drinks. Third, be careful with foods that have a high glycemic index, especially first thing in the morning. And the other mistake is not having a routine for sleep and also for taking your medications. From 0 to 10, what score would you give this video? If it's a 10, I'll make more videos like this one. Now I'm going to leave a suggestion for you to watch. It's a video where I talked about the dangers of vitamin D. Did you know that this vitamin can be dangerous? There are levels in the blood. If you reach those levels, you can have a lot of side effects, even heart arrhythmias, kidney stones, increased risk of heart attack. Did you know that? What is that level? In this video here, I'm going to leave the suggestion. I want you to watch it to learn more about vitamin D, all based on scientific evidence. Take care. See you next time.